Hello, we are students with the University of Kentucky College of Pharmacy, and we have partnered with the NEST to provide you some health information. And in this presentation, we're going to be talking about vaccination. Vaccines are one of the most helpful ways to prevent you from getting sick. They help to prevent the spread of diseases across the communities and people that we care about. Vaccines are easy to get, and they have low risks of side effects. Essentially, vaccines helps you to save money because it in the long run it prevents you from getting sick, and it prevents you from getting to see the doctors. So essentially, we advise patients to get vaccinated. And here we're going to talk to you about some of the most top 5 vaccines that we recommend that patients get.
So this is a list of vaccines that we compiled that you should ask your local pharmacist or primary care doctor at your next visit. We highlighted the most important age ranges and reasons to get each vaccine, but this is not an all-inclusive list. The first is just your general flu shot. This is something that you need every year. It just prevents you from feeling the extreme fatigue that the flu can bring and protect your family. This is also the same thing with the COVID-19 vaccine that recently has come out. And this is a 2-dose series that can help reduce the chances of contracting the dangerous COVID-19 virus. And especially if you're over the age of 60, it is highly recommended to get the shingles vaccine, which is also known as Shingrix. This is caused by anyone who has had exposure to chickenpox when they were younger, and shingles can be show up later in life, and it can be prevented with this vaccine. And also, if you're over the age of 65, pneumonia can um, can really take a toll on your body and your breathing, and could unfortunately lead up to a lot of complications. So if you get this vaccine, it also reduces the chances of getting the pneumonia. And with the Tdap, this covers 3 uh, different types of sicknesses you can get, and it's recommended to receive this every 10 years, but especially whenever you're surrounded by a newborn baby, and if you come in contact with by stepping on a rusty nail or anything that could help contract this a little bit more. Secondly, hepatitis A is a viral infection that can inflame the liver. It is commonly found in unwashed foods. Usually, this is caused by outbreak scenarios in the community, and usually they're televised, so you can also be aware. But just to prevent, by getting the vaccine early, you can help prevent that prior. And additionally, hepatitis B is another form of that can be spread, and it is important to get that vaccine as well. Now, where exactly would be the best place to go is all the different types of pharmacies listed below. They offer pharmacists who are able to vaccinate, and you can get those while you're grocery shopping, and they're extremely accessible in your community. So you can also get vaccines done at your primary care office as well. But if you're looking for more information about the specific vaccines I listed prior, there's fantastic information that can be found at the link listed above, which is at the CDC website. Additionally, prices are constantly changing, and many of the listed locations can provide excellent prices and promotions for getting vaccines. Check with your local pharmacist and see if they can run a price check to see if your insurance can cover any amount of the vaccines listed right for you. Thank you so much for watching our presentation today on vaccinations, and be sure to check out our channel for information on other common health conditions.